Ladies and gentlemen, welcome to another session with Dr. Fresh. Today we're doing the part 2 of stroke. In the part 1, we talked about how do stroke occur. That stroke is an injury to the brain. And in this concept, the brain is deprived of oxygen and blood. So the blood carries oxygen and nutrient, the brain is deprived. And to the extent the brain is deprived will determine to the severity of the stroke. Now, the part of the brain affected will determine the area of the defect, if it's going to be speech, if it's going to be a hemiplegic stroke, one part of the body being affected, or both limbs, or both the hand, that is the upper limbs, and the lower limbs, the hand and the feet. Today, we're going to talk about the part 2. The part 2, I want you to understand that when a person has a stroke, the index of recovery and survival is dependent on some factors. Number one, the commencement of treatment. Now, when there's an injury to the brain, there are things that could be done to salvage the brain and put the patient on track for full recovery. If this is not done in a limited period of time, whatever has happened will become a permanent effect on the patient, number one. Number two, in stroke patients, so you know, if they have other comorbidities like they are diabetic, they are overweight or obese, as the case may be, they've had a previous stroke, these things are factors are going to be considered in being able to prognosticate, to tell whether this patient will be able to have a good life or a better life and the quality of care. So if you have a stroke, it's not the time to go and start taking agbo or go and buy one drink, one herb to drink one thing or the other. No. Go to the doctor. Go and see the doctor. I mean, a doctor who can manage stroke, who has managed, who is managing and knows what it entails. However, go to the teaching hospital and be managed by a neurologist. A neurology team in collaboration with a cardiology team, pending other comorbidities you may have. Stroke is a menace that have reduced the quality of life of a lot of our fathers and mothers cut across the globe. Most of them are moribund, redundant. And let's not forget there's a place of physiotherapy, layman call exercise, that is physical therapy, to be able to mobilize and utilize that part of the body so you consistently use. Subscribe, watch, and share. Don't forget that if you know better, you will do better.